Good evening. Before starting, I would like to thank Sinocare for inviting me over here. Uh, I would do special thanks to Ms. Punita Khattar for the invitation, and I also would like to thank Dr. A.B. Day for introducing me to this organization. The theme of the organization I really liked, that we should take care of our elderly at present and we should plan for them for future. I'm Dr. Sushma Bhatnagar, professor and heading the Department of Palliative Medicine at AIMS and NCHHL. I will tell you something about what is my view about the elderly care. So as in childhood, since the childhood we have learned, and as in the Indian culture says that we have to look after our elderly. And when it comes to the elderly people, they first comes your parents and their grandparents. And we learn since the beginning that we have to take care of them when they are aging, when they are physiologically they are declining, or if they are having some kind of any comorbidity, we have to look after, and that we looked after. When I talk about the 2 decades of experience at an institute, I can tell you that at the institute, although it was slow, but by this time, we have integrated concept of palliative care in the continuum of care at every aspect. This includes even not only the elderly people, but all the patients. So when it comes to elderly, our aim is very clear that if cure is possible, we will do everything to cure. If cure will not be possible, we will have a family meeting. We will discuss with the primary physician and family people. We will discuss about the person, that what is happening to this person, what is the realistic hope, and will give honest information. And once they have understood well, we plan that how to take care of this person, whether in the hospital or in the hospice or at home. If we are sending home, we empower family members that how they should take care of their person when they are taking them home. So this is what we have created at All India Institute of Medical Sciences, which includes 2 policies, which also includes 2 policies, that is pain management policies and end of life care policy. In pain management policy, we are committed that all our patients, those who are registered in institute, they should be pain free. If an elderly person is admitted in the institute, we make sure that they should not have pain. In end of life care policy, we are committed that if our patient, which includes elderly patients also, and we have decided by doing all the investigation and diagnosis and this thing, that treatment is not going to be possible, and so we don't desert this person. We make a very good care plan for him, and which care plan includes symptom management, pain management or dyspnea management, and whatever symptoms we anticipate, we plan that how to take care of the person so that the end should be dignified. This is what we have created in the All India Institute of Medical Sciences. Now I'll tell you one more recent experience of mine as a chairperson of COVID services at National Cancer Institute, Jhajjar. Since last 2 years, since last March 2020, we all were fighting COVID, and we are still fighting. And what we have seen that what is my observation, that in wave 1, there were a lot of elderly people, those who have come for admission, and there was a dire need to look after them differently. Means when they are in the COVID center, they are alone, they feel distressed, they feel, means COVID and death, people think synonymous, so they are fearful that they are going to die. So this is important for a doctor and for a nurse. We have made a very good robust protocol and for all these patients, including especially for elderly patients, that how we can give them a good counseling, how we can give them a confidence that we are always there for them. NCI Jhajjar in COVID center, we have made robust protocol for taking care of elderly patient, that they should gain confidence that they are not alone. They should not be fearful, and they should not be thinking that if they are COVID positive means they are going to die. So we have really made, and this problem was really aggravated when it came COVID wave 2. So you all must have known that it was a horrible time we all faced, especially for elderly. Uh, I have noticed many of my uncle and auntie constantly they are calling me on my mobile. Auntie is admitted in one hospital, uncle is admitted in another hospital, and they all worried. They were worried. And what I have noticed, which I really want to tell you, that two important things, that it was important to give them a confidence that it's a it's a difficult time. Everyone is looking after them, and it is not necessary that they will never be able to meet. We are looking after them. Second important thing which we have noticed, that in wave 2 we have almost seen more than 2,500 patients, and what I have noticed, that out of 2,500 patients, almost 450 patients were more than age 60 years of age, and out of 450 patients, only 22 patients were, have received vaccine. It is important here to realize that vaccine is very important in COVID, and especially for elderly. What is the next finding, which is very eye opener, that the people, those who have received both the vaccines, the severity of the disease was very mild, and they could go home easily. But almost 250 patients, those who have not received a single dose of vaccine, the death rate was almost 35.5%. So this is again a very important finding which we have. I'm narrating from my own center, that this is important, that as the theme of this organization says, that we have to look after them today and we have to plan for future. So look after for today is that we should vaccinate, because this is the most important problem which is pondering around, which is on our head, that our elderly should not get infected with COVID. Once they are infected with COVID, and especially if they are having comorbidity, it is really difficult for medical fraternity to save them. So it is important that all our elderly should be vaccinated immediately, so that the severity of the disease will be less and we will be able to do better with them. Although as Indian culture suggests that we have to look after, and we look after our parents very well, and our elderly very well, but this is also true that many of our elderly, they are alone, or take care of your elderly as you are well versed and you have been taught by in your culture, useful for them. Thank you very much.